Hello again, everyone. I'm here for my second round of chemo. Got the first round about 2 weeks ago. Went really well. Wear the bag of chemo juice in a fanny pack for 2 days, get it unhooked on the third, and I'm back in the suite. We have a nice view there. You can see I've got 1, 2, 3 bags running into my chest here. See if I can show you my porta-cath. So that's installed. It's a port installed in my chest, and then you can see this is the catheter that runs into my jugular, and so all of this stuff runs up into me through there. Didn't remember it being this long to have a new pump attached. It's been about 5 hours here this morning already. So I took the morning off from work, and we're into the afternoon. It's 1 o'clock, and so far they tell me these meds are to kind of anti-nausea meds, kind of pre-meds before the chemo, so that I don't have as many side effects. I met with Dr. Jaramillo today, my oncologist, and she showed me my blood work and said my neutrophils are low. So my white blood cells are low, which we expect because chemo hits the marrow. But she said she does not want to see them go lower than this. This means I'm at risk for infection. So if it goes lower than this, then they may delay the next round of chemo by a week, just to let my body kind of recover a bit. So instead of a 2-week gap, it'd be a 3-week gap. All right, so just a recap. I'm feeling the best I felt the last 2 weeks. I feel the best I felt in a year. All symptoms across the board are better, from bathroom trips to pain to sleep quality to energy levels. Everything is improved probably 40%, which she was very surprised to see that big of an improvement that quickly. However, I did ask her what I asked her 3 questions. I said, do you consider this round of chemo that I'm going through, you consider it to be palliative? Palliative means it's just for comfort. It's trying to make you feel better, as opposed to actually treating a problem or fixing a problem. She said, absolutely palliative. I said, absolutely not palliative. She said, this is aggressive treatment. She said, if I was going palliative with you, I would give you 3 meds that we know help you feel better and help with your symptoms, kind of like the way Advil might help with pain, even though it's not fixing the injury that caused the pain. But we're giving you five meds in your chemo, and those are aimed at aggressively shrinking the tumors, which she said creates better outcomes post-op. When I have a bowel resection, also can shrink tumors down to sometimes nothing, and make them kind of a non-issue. I also asked her what her opinion was of my life expectancy. So she said your 3-year survival rate, if you do the chemo and the chemo works well, your three-year survival rate is 30%. So that's a new wrinkle that I had not expected. 3-year, 30% survival if chemo is effective, continues to be effective as it is. So initially she told me the 5-year was 15% survival, and I asked her how much different my survival rate might be if I was not doing the chemo, and she said it's just too hard to tell because we haven't gotten enough data points yet. So far, she said she's very encouraged by how well I'm feeling, and I actually started exercising, did my first body weight exercise workout the other day. Very simple. Did 10 single leg squats on each leg, and I did 2 sets of 10 push-ups. I've also been adding in 2-mile walks in the hills with some decent elevation. And if I'm feeling up to it today, I'd like to go do that too. I got a bunch of tubes everywhere, but should work. And so yeah, that's where we are. She also lastly said that my liver, the cancer in my liver, is the thing that is most important, even more than the big tumor in my colon. She said the liver, how my liver does, is gonna pretty much determine most of what my outcomes are. So because we can always just remove the tumor in the colon, you can remove it. Liver, apparently not as easy, and I have 5 spots there. They're all small, but they are cancerous, so we'll be watching that most closely, she said. She said, I have to wear a mask around patients or in close contact with people because my immune system is being intentionally beaten down in the course of the chemo, trying to kill the cancer, but it also beats down your immune system at the same time. So I need to be super careful not to get sick. So she said, anytime you have a fever, that might be an ER visit. So don't be around anyone with sniffles. Yeah, so I've just gotten used to going without a mask at the office with patients because I'm vaccinated, which I'm really glad I did that. One less thing to worry about, but now I have to worry about colds and flu and bacterial infections and stuff. So anyway, little new twist on where we are. I will probably check in with you guys a little bit later today and just kind of like, right now, I'm still on my pre-meds, so I haven't started my chemo yet, but I'll let y'all know how it goes. See you next time. Hey there. So, this is the afternoon. I'm walking on a fence there. You can see I'm on my chemo. This is the afternoon. Here's my little bag. Inside, it's my bag of chemo juice. It's this little ball. See if you can see that ball right there. And that will drain over the next 2 days. And that was a 6-hour process. So apparently each time I go in every 2 weeks for chemo, it is a 6-hour process, and they do some pre-meds I think they're for, mostly for nausea, to prevent nausea from the chemo, which I've had 0 of. Who knows if it's from the meds or not. And I've just completed a 2-mile hike in the hills with some pretty decent elevation. Feels really good. My energy level today on chemo, it's pumping into my jugular as we speak. My energy levels today are the best they've been in the last 2 weeks, and the last 2 weeks have been better than the last year. So, all in all, I'm happy at the moment. Definitely happy at the moment. I told you in the previous video a little bit about what my oncologist told me, Dr. Jaramillo, and she's a very straight shooter, which I appreciate. She doesn't sugarcoat things. So she said, among other things, that my 3-year survival rate is 30% with my diagnosis, which is not as much better as I was hoping in 3 years versus 5 years is 15%. But I'm basically, again, like I said, trying to make sure I have the very best, healthiest body I can to go through and weather this process. So basically, chemo is just trying to kill the cancer before it kills you. So it's a cross your fingers and hope that the chemo doesn't break you and that it breaks the cancer. So I think I mentioned the 3 questions I asked her. Is my chemo palliative, which means is it intended just to help me feel good and not actually save my life? She said, no, it is not palliative. If it was, I would have given you 5 meds. I'm just giving you, I would have given you 3 meds that would help you feel better. I'm giving you 5, and they are aggressive, and I'm giving them to you because you're young and because you're healthy, and I think you can handle them and get the benefit from them. So that was a relief. I wanted to make sure, as sincere as she seems, that she's being honest with me about what my outcomes are. And I mean, seems pretty honest. She could have easily sugarcoated some of this stuff, and she did not. So, feeling great on this hike. My blood pressure's down. I think my last blood pressure reading was 106/68, which is excellent. At the beginning of all this, maybe 2 months ago, my blood pressure was a little high. It was 130/90, which is high blood pressure. Again, it's from not being able to move or exercise, and now I can. So I just went on a little over 2 miles, did not have a single bathroom trip, which seems like, well, hey, I never have a bathroom trip when I go on a 2-mile walk. Well, I do. Historically, it may be 4 or 5 bathroom trips in 2 miles, if I make it 2 miles. So this is already trending way better. We'll see if it is a continuing trend. But for now, I'm very happy. Not distracted at all, not depressed, excited to wake up every morning, see what the day brings. Again, this went really well. The way it works is I put over my port, which is under here, before I go in, I put some lidocaine, which is a numbing cream, and then a patch on it an hour before they use the port, before they put the chemo in. And that just numbs it and makes it completely painless when they put the port in, and then they pull it out. And then Thursday, so today's Tuesday, Thursday afternoon I'll have this taken off. It'll be empty. And then I'm good for, a week and a half before I do the same thing again. We should be getting follow-up scans to compare the size of the tumors. And fingers crossed, what we want is those will probably happen 2 months after my treatment start, 2 months of treatment. We want them to be getting visibly smaller. If they are, it gives us a big thumbs up. Hey, this is likely going to be a very effective course. If after 2 months they're about the same or they're bigger, well, then it means I have less time. Almost certainly. So I'm going to start preparing for the worst, but also preparing for the best by keeping myself as healthy as I can. So thanks for all of you guys listening and watching. Hope it's interesting. And if you're going through the same thing yourself, I'm sorry to hear that. But at least you can maybe get a glimpse of what it could be like, or what each of these exams and experiences feels like. If that's helpful, great. See y'all next time.